Right when you walk in the door, you just feel at home.
You don't just feel like you're another patient on the list.
Peace. There's a peace when you go in there.
At Natural Fertility Care, our philosophy is to truly embrace the dignity of every human person, of all of our patients and of their unborn babies and of their families.
Our philosophy is to really treat each person with dignity and to treat their bodies with the dignity that every person has within them.
So we are the only practice in the Baltimore metropolitan area that advocates for natural family planning and doesn't use artificial contraception for family planning.
Natural family planning is a way in which couples can decide if they want to use their fertile time of the month to either achieve or avoid pregnancy. It really takes fertility into the hands of the couple rather than into the hands of only the woman.
I didn't really grow up knowing that people did natural family planning. It was just foreign to me, and we just started to pray about it and talk about it and think about it. And I mean, for me, it was like a total conversion of heart. Like, wow, this is what we need to do. This is like the right thing to do.
The day after my fourth was born, the OB came in and asked me, so do you need a script for birth control? I said, no, we practice natural family planning. She said, so you don't care if this happens again? But just the way she said it, just like, I need to find somebody else.
There's a truth that's written in our hearts that we are wonderfully made, that we are made in the image and likeness of God. And that natural family planning respects that and embraces that. People come from all walks of life and we have a certain philosophy, but that shouldn't make anybody feel like they should be a certain way. Part of our mission is to make people feel welcomed and never judged.
I appreciate the fact that I'm working with physicians who have values and who practice what they believe. When a patient calls in and they ask, what do you think about Dr. Sorra? What do you think about Dr. Pogue? It's really nice to let them know that I firsthand have a personal experience with them and that they are my provider as well. And sometimes people are a little surprised that I see the physicians that I work with, but I let them know when you understand and you're aware of the excellent care that the providers give, you wouldn't want to go anywhere else.
I was looking for another doctor, and my sister-in-law goes to Dr. Sorra. So I went and just met her just for an initial appointment, and I told her my history, and she just sat and listened. She didn't make me feel like she was rushed. She listened to everything, and I told her I didn't want to have C-sections. I wanted to continue to have VBACs if I could. And I'm so grateful to her because I would have had 3 C-sections, and instead I've had great deliveries and births.
Dr. Sorra is very low-key. She's very laid back, but when she has to be, she's on, and she will let me know how it is and what needs to be done.
I have complete confidence in her clinical abilities and just reinforced by so many professionals that I know in the hospital community, nurses, other doctors, and when she makes a recommendation, it's with the patient's and the child's best interest at heart, and so can sleep easy and rest easy knowing that that's the case.
It just doesn't get any better than women who just appreciate where you're coming from, who love your baby and think that it is a baby. I like that from the very minute you walk through the door, from conception, they're gonna say, this is your baby, and treat them with dignity and respect like a child, just even when it's this, teeny tiny little thing on the screen.
You want somebody who knows what they're doing, and you want somebody with a heart, that's where you need to go. And if you've got to drive a little bit, it's worth it. So that's what I tell people.
When I joined the practice, Dr. Sorra had been looking for somebody else. She unexpectedly had this great amount of patients who were coming to her, which was amazing. And the practice was definitely blessed from its beginning. I had patients saying, "We prayed for you before you even came here. Been praying for you. We're so happy that you're here." And these are people I've been meeting for the first time. And what a greater joy than to work in a place where people were praying for you before you even met them.
I always wondered how this practice would survive. I always wondered who would come to an OBGYN that doesn't prescribe birth control. But this practice is thriving because of our patients. So, we have wonderful, amazing patients that are loyal to us and that are looking for what we are providing. It's such a grace. They often thank me for being their doctor, but I'm so much more grateful that they're our patients.